So as you begin on the pelvic limb and the calf, you want to make your skin incisions. So on the cranial half, you can see that it's still bagged up, so you can leave the bag on most of your calf. You really just need to be able to get to the hind end. So your skin incisions, you'll start with a mid-dorsal incision and just basically go from the level of the tubercocci, which is around here. So it's a little more cranial than you saw in the horse. So you're going just a little bit further cranial than we did in the horse. So the thigh muscles are kind of ending here, but you want to go about an inch further cranially so that you can get that whole gluteal area. So you want to remove that skin. You want to cut down the dorsal midline. Then you want to make a vertical incision just in front of that thigh that I just mentioned. And then you want to go around the base of the tail. So going around the base of the tail and then down the back side on the medial side. And then you're going to reflect as one big sheet of skin there. So you'll do that on the left and the right side. So we have the other side also. And just reflect those skin flaps down so that you can see all those proximal muscles. So on the calf, it's a little bit different than in the pony because we don't have the biceps femoris muscle. Instead, we have a combination of your superficial gluteal muscle and your biceps femoris muscle. So those two together are creating this gluteobiceps. So it's starting here, and going back along here. Your division is right there. So you have that combination in the calf. So that is definitely different than in the pony, so make sure you see that, where you have this gluteobiceps. So you're going to isolate the borders of that and then make a dorsal incision. I want to put that back. I don't know if it'll stay, but those are your hamstring muscles there. So you want to make a dorsal incision and then reflect your entire gluteobiceps distally towards the stifle. So just like we did in the pony. Here we have the semitendinosus muscle is the next one. So that's the one that keeps falling down here. So semitendinosus is a little bit different also in the calf because it just has one head of origin. So you'll just have one belly to that muscle. So that one you want to isolate as well and differentiate it from the adjacent semimembranosus muscle. So semitendinosus, semimembranosus. So semitendinosus you want to cut proximally and also reflect that distally toward that stifle. Like that. So then you have this semimembranosus muscle. So in the calf, this muscle is extremely thick and you may not be able to cut through it all. Try to do your best here on the left side and cut through that semimembranosus as far as you can. It's very, very thick. So you want to do that. It won't reflect much because there's so much muscle there, but try and at least cut through it so that we'll be able to remove the left limb later. All right, so then we'll move on to those gluteals. So in the pony, we had the superficial gluteal covering this area, but in the calf, remember that the superficial gluteal is tied in with your biceps femoris to make the gluteobiceps. So we've already taken care of that superficial piece. So here we're seeing the middle gluteal muscle right here. And it's not as massive as it was in the pony, so a little bit smaller. You want to make a similar cut, and you want to cut across that middle gluteal all the way across in kind of an arching cut and cut it away so that we can reflect it. And so you'll make that cut and then peel it away. And then underneath, it doesn't reflect quite as far, but underneath you'll have an accessory gluteal. So accessory gluteal is pretty small, relatively speaking. So this is the accessory gluteal. So you also want to transect that and then reflect it as well. If you remember in the pony, we found that trochanteric bursa underneath this accessory gluteal when we reflected it all the way. However, in the calf, you'll have a little bit more trouble because you have the vastus lateralis kind of in your way. So that's part of the quadriceps muscle group. So when you reflect this accessory gluteal, you won't be able to actually get to that bursa. So don't worry about that. But just reflect that as far as you can. And underneath, you can see the deep gluteal muscle. So it's that fan shape underneath that accessory gluteal. All of this is deep. You can also see the very large sciatic nerve right here coming out. So that's kind of going over the top of your deep gluteal muscle. And also cranially, you'll have this tensor fascia lata muscle that you'll have the edge of that you may have to reflect slightly. as you work. So if you reflect that just slightly, you should be able to get to all these muscles. It's not as in the way as it was in the pony, but that's the tensor fascia lata attached to the fascia lata. And then your gluteals, after that, you want to work on the sciatic nerve. So you want to remove some of the fat and fascia, which I've done here. And then we'll take a little bit of a closer look at this area. So here we're just going to take a little bit more of a close-up view of those gluteal muscles and that whole area. Here we have that middle gluteal that we've cut and reflected, so take that back. Then underneath you can see the accessory gluteal, which is relatively small. So you also want to transect that and reflect it as well. And then underneath that will be your deep gluteal muscle. So deep gluteal muscle is right here, and then that sciatic nerve is running right over that deep gluteal. So in the calf, this nerve is very, very large. You'll see that it's pretty massive in the calf, and so you can't really miss it. The sciatic nerve coming out of the greater sciatic foramen, so that's this kind of opening right here. So greater sciatic foramen, and that also has the cranial gluteal artery coming out. So here I can just kind of pick up a little bit of that so you can see it coming out of there, right there. So cranial gluteal artery coming out, which has been cut since I reflected the gluteals. Cranial gluteal artery, sciatic nerve, both coming out of the greater sciatic foramen. Then we need to take a quick look at the lesser sciatic foramen, which is a little bit tricky to see in the calf, at least I think so. So if you kind of pull down your middle gluteal out of the way, you'll see that it's much more dorsal in the calf than it was in the pony. So in the pony we were down in here behind the middle gluteal for the lesser sciatic foramen, but in the calf we're going to be more towards the base of the tail, so moving up dorsally slightly. And you'll find the caudal gluteal artery coming out of that lesser sciatic foramen in the calf. So this is a little bit different than the pony, so make sure you know those differences. That this has the caudal gluteal artery coming out of the lesser sciatic foramen, which is this hole here. And then in the calf, we do not have an internal obturator muscle, so you will not look for an internal obturator tendon coming out of there. However, in the pony, we did have an internal obturator, so make sure you know those differences. Now we're looking at the right side of the calf specimen, doing the proximal pelvic limbs. Here on the right side, I haven't taken off as much fascia as I did on the left side, so it's a little less clean and a little less clear, but this is more realistic as to what you'll see. So the definitions between the muscles won't be very clear, and you'll have to find those borders in that thick fascia. So here on the right side, we have the same thing happening. So we have the gluteobiceps muscle, so that's the combination of a superficial gluteal and the biceps femoris. So this whole thing, this whole muscle, is the gluteobiceps muscle. So again, you want to transect that dorsally and caudally, and you're going to reflect the whole thing distally towards the stifle. So take that all the way down. Then you'll have your semitendinosus muscles. So semitendinosus right here, and here is the semimembranosus muscle. So semitendinosus, semimembranosus. And you want to transect your semitendinosus muscle proximally and then reflect it distally towards the stifle as well. And here on the right side, I've left my semimembranosus muscle attached. You can do that as well on the right side in your calf. It isn't necessary to cut it yet on this side, so you can go ahead and just leave this semimembranosus muscle. It's very, very thick in the calf. So semimembranosus muscle there. And now we'll take a look at the gluteal muscles. So we already reflected that gluteobiceps, which accounts for our superficial gluteal. And here we have the middle gluteal, right here. It's kind of rounded shape. Again, you want to transect that all the way across and then peel it back and reflect it distally. And then underneath, you'll find the accessory gluteal right here. You'll transect that as well and then reflect that to see the deep gluteal. So now we'll take a closer look at that area. So now we'll just take a closer look at that gluteal area. Here we have the middle gluteal back in place. So you'll just reflect that distally. Then underneath that, you're looking for this little accessory gluteal muscle right here. So it's just a very small piece, and you'll transect that as well and reflect it distally towards that middle gluteal. Again, we won't see that trochanteric bursa because we have a muscle in the way, so don't worry about that. And then here you see that fan-shaped deep gluteal muscle. So all of this is deep gluteal. And then you have this very large sciatic nerve running over the top of that deep gluteal muscle. So sciatic nerve is coming out of the greater sciatic foramen, which is this hole here. Then here you also have the cranial gluteal artery coming out as well. So both of those, the sciatic nerve and the cranial gluteal artery, both come out of greater sciatic foramen in the calf here. Then we have just slightly caudally. So if you pull your middle gluteal down, hopefully you'll be able to find, remember that you're going a little more dorsal towards the base of the tail to look for this lesser sciatic foramen, this hole here in the sacrosciatic ligament, where the caudal gluteal artery will come out in the calf. So here's that nice example of the caudal gluteal artery coming out of that lesser sciatic foramen, which is this hole here. So here we're going to take off the left hind limb of the calf specimen. Just like in the pony, we cut the deep gluteal muscle, we cut the tensor fascia lata, and we cut the sciatic nerve on the lateral side, and then we use the hoist and put the calf on the floor into right lateral recumbency. And now we will remove the left hind limb. So you'll need an assistant, which I have Nick here to help me, and you'll have your assistant put one foot down on the leg that's down on the floor, and then have them pull up on the other limb, so the left limb. So you're pulling it away to get some leverage to help you cut through things on the midline here. So I'm going to get in there and cut just off the midline, so you have to be careful of the reproductive stuff, and these calves have been repurposed from surgery, so you have a lot of incisions. So just try and kind of stay to the side of all of that, and we're just removing that left hind limb. We don't want to go into the abdomen. So you start with cutting through the skin, and you'll kind of connect your incision with your lateral skin incision from the other side. Like that. Right, and then you'll have your assistant pull up as much as they can. Here, let me just cut this side real quick so I can get a little more in there. There we go. So try not to enter the abdomen. You don't want to go into the abdomen. Just kind of leave those muscles intact. And just start cutting through the fascia. And then when you abduct it even more and pull it up, it'll kind of pull away and you'll see some more fascia. And you just keep cutting in there. Then you'll also be cutting through the gracilis, which I'm doing now. And then your adductor muscle. And in the calf, we do not have that accessory ligament, so we don't need to look for that. However, we do want to try and see the ligament of the femoral head when we get to that hip joint. I'm going to try and find that kind of hip joint capsule so that we can open it up. We're just about there. So I can kind of start feeling it right in here. You'll have to cut through the vessels and the nerves. There we go. So now I can see my acetabulum, so I can see the lip of it right here, the rim. So the acetabulum is where that hip joint is. So right here would be the ligament of the femoral head, which you can't see very well because it's quite dark in there. But we'll try and take a little bit of a closer look as we cut it to remove this limb. All right, so here you can see the head of the femur, and you can see the lip of the acetabulum. It's still quite dark in there, but I'm just going to put my probe behind that ligament of the head of the femur so that hopefully you can see that there. So right here is the ligament of the head of the femur. So now we have to cut through that to remove the limb. finish cutting through our muscles here. We're just about there. And looks like one more little cut here. And there we go. So now the limb is free. You can see the acetabulum here. So here in the acetabulum, after you remove the limb, you have the remnants of your ligament of the femoral head, which we had to cut to remove that left limb.